Hi, I am Dr. Nithin, Consultant Head of the Emergency Department, SPARSH Hospital, Nagar. Today I am going to speak about the cardiac arrest. You have seen many patients. I am not here to say patients, many people attaining a cardiac arrest while doing gym or while doing any physical activities. So, or you have seen recently in school functions and or any other functions, patient collapses suddenly, and most of them doesn't even know what to do in that when patient suddenly collapses. So there is something called as a basic life support. Most of the events happens outside the hospital. So the basic life support should be like whenever a patient collapses, first and utmost important thing is to check for the response of the patient, see if the patient responds or not. If the patient is not responding, immediately call for help. So calling for help outside the hospital, call an ambulance, call an activate emergency medical response team. But as you know, it takes much time for the response team to come in and address the patient who has collapsed. So meanwhile, what we can do is just check for the pulse. Checking the pulse, mostly we prefer checking the central pulse, where the neck of the patient, check for the pulse. At least for 5 seconds, check for the pulse. If you feel that there is no pulse, there is something called as a compressions, that is CPR, Cardiopulmonary Resuscitation. What we do is we hold the hand, support the hand, the other hands with interlocking the hands, use the wrist, use the heel of the hand, the lower end of the chest, start giving compressions till you attain the help. That will definitely save a life, and that is very important to start a patient with compressions so that the patient can have a second chance of life till you get a emergency medical response team to give a further advanced cardiac life support. So I think all the practitioners or all the laymen or all the people in the society should know about the basic life support. It will help to give a patient who collapses unresponsive, who have a cardiac arrest, at least the time which so that the advanced cardiac team can take over the further resuscitation. Till then, without doing anything, the compressions, that is CPR, is very important to start in that hour of minute. That will help you to bridge the time gap between the advanced cardiac team comes and takes over. This is about the CPR in an unresponsive patient. Each one should know how to give CPR. That will help to save many more lives. Please learn to do CPR and save much more lives. Thank you.